let us start our learning and sharing session. And we have my good friend Mayor Beng Climaco first. Mayor Beng, are you okay to the discussion?
Yes, Malo, I'm always ready to serve God and country and the Philippines. Buenos días a todos. Paz de Dios y abrazo de la Nuestra Señora la Virgen del Pilar y San Jose a todos desde la ciudad de Zamboanga. Zamboanga City is the third largest in the land area and the sixth most populous in the Philippines, with an estimated population of almost 1 million. We are the center of Region 9, Zamboanga City Peninsula, and is surrounded by Basilan, Sulu, and Tawi-Tawi of the BARMM. 7 years ago, the people of Zamboanga endured a humanitarian crisis because of the MNL attack, leaving 120,000 displaced. With God's grace, we proved our resiliency due to the support of the national government and the international organizations. We are, with the grace of God, a stronger Muslim, Lumad, Christian Zamboangueños. Today, however, the COVID-19 pandemic is a global challenge for all. The city of Zamboanga, the city government, on March 20th, was the first and among the first LGUs to implement enhanced community quarantine. On March 24, our first case of COVID-19 was reported. Our response was anchored on 4 key areas: entry and exit control, contact tracing, treatment and containment, and risk communication. We have activated a 24-hour operation center with a 24/7 hotline and helpline and teleconsult. Managing a public health emergency requires that we heal the sick and, more importantly, feed the hungry. Our COVID-19 battle plan with God's grace. As of June 14, 2020, Zamboanga City has 185 reported cases and 150 recoveries. Gracias a Dios. Our main policy direction is improving testing capacity with the aim of 1 to 2% of our population. There are 2 operational COVID-19 testing laboratories now: the ZCMC Department of Agriculture Laboratory with an automated extraction kit, and the ZCMC Gene Expert Laboratory. The Philippine Red Cross run PCR laboratory is awaiting equipment to operationalize, while the construction of the city government-funded molecular laboratory has commenced. To date, a total of 2,033 were tested. The setting up of these labs have been possible with the national IATF and the WHO. We thank our contact tracing team as well for their efforts in preventing the further spread of the virus. The city's operations center handles the contact tracing to the city epidemiology and surveillance unit following the WHO surveillance guidelines for identifying, tracing, and monitoring. On treatment and containment, we are grateful for the strong collaboration and support of the private sector NGOs, donors, partners, and consultants, as well as national government support. The Ateneo de Zamboanga University Lantaca campus, a former hotel, was converted into an isolation facility run by the Private Hospitals Association, the City Health, and the Department of Health, with 60-bed capacity, management for mild to moderate cases. From moderate to severe cases, however, they are sent to Zamboanga City Medical Center, the only tertiary hospital in Region 9, as well as Basilan, Sulu, and Tawi-Tawi area for COVID-19. For isolation and quarantine, we have the Zamboanga Eco Zone. There are 4 buildings there, and there are 274 bed capacity. The Kabatangan DPWH Evacuation Center has 50 beds, and the tents in the Reformatory Center and local hotels for returning residents. We work with security forces to ensure the successful implementation of our quarantine policies, checkpoints and curfew monitoring, food distribution. Staff assistance was reported orderly by the police. We are working with USAID Surge and USAID Reach Health To complete our COVID-19 recovery and resiliency plan, a Zamboanga UNDP disaster risk specialist is also helping out pro bono with the framework of our recovery plan. Our blueprint for the new normal aimed at helping affected sectors recover. The preemptive actions taken in the early implementation of the ECQ and its extension resulted to favorable results. We avoided a sustained community transmission with only 16 cases acquired outside the reformatory facility and the COVID-19 epicenter, local hotels made into quarantine facilities for returning residents, 1,312 stranded individuals returned home through LGU-funded sweeper flights from Manila, Cebu, Davao, and other areas, and we have tested 844. It is very imperative to tackle emerging problems in the new normal. The threat and the resurgence of cases due to the arrival of Filipino deportees from Malaysia targeted in the upcoming weeks is 1,576 or expected 5,300. Synchronized testing and mobile application for contact tracing and data management, efficient barangay health emergency response team, the persistence of disinformation in media platforms that create confusion and mistrust, unreliable power supply interrupting the testing process. We need to increase testing capacity through our molecular laboratory with complete equipment and manpower training and more testing kits. We need to add personnel for specimen collection and border control, testing laboratories, quarantine monitoring, and training on infectious disease specialists for Region 9, Basulta, and BARM. As local chief executive who endured a humanitarian crisis, the COVID-19 pandemic is another challenge we need to face and to win with God's grace and everyone's support. COVID-19 has taught us faith in God, hope in humanity in the new normal, and love of family. We have a long journey ahead and we need each other to win as one. Muchísimas gracias y vaya con Dios. Together with Jessie Lapinid, Garnet Francisco, Mike Saavedra, this is Team Zamboanga telling everyone, vaya con Dios a todos.
Thank you so much, Mayor Beng Climaco. Next would be, is Mayor Rosal already present? If he is not yet here, can we have Mayor Benjie Magalong?
Magandang umaga po sa inyo lahat, to my colleagues. Good morning. I just would like to forego with the usual greetings and instead would like to assure everyone that all courtesies are duly observed. Ma'am Beng, my favorite mayor, magandang umaga po sa inyo. Naimbag nagsapa kada tayo amin. What I'm going to present to you is, or I'm going to share with you is our contact tracing methodology in the city of Baguio. I would like to inform you that we came up with this system when we were sometime 3 weeks into our ECQ. And that's probably the reason why we differ from the usual COVID Kaya and safe city system that's now being adopted by DOH and the other agencies. But nonetheless, we're making sure that our contact tracing system will be aligned with the system that's now being adopted by the national government. May I know if you can already see my presentation? Nakikita na ho ba yung slides ko?
Yes, Mayor.
Yes, Mayor.
Thank you po. Thank you po. I just would like to present to you our conceptual framework. Once we have identified a positive patient, we immediately isolate him or isolate her. Then we do the testing, and then we immediately launch the contact tracing. Let me share with you our contact tracing management workflow. Once we have a positive patient, what we usually do is we immediately secure her or his personal circumstances, and our investigator conducts the interview. After the interview, the contact tracing is immediately launched. Simultaneously, I, as mayor, orders the lockdown of the barangay, and we immediately deploy our security forces. And at the same time, I personally, because this is something a bit sensitive, is I appeal to the patient. I personally talk to the patient and appeal that he, as much possible, agree to the full disclosure of his identity. This will hasten contact tracing. And once he agrees with that, our PIO immediately sends a post to social media and mainstream media. At the same time, I inform all the necessary bodies or the appropriate bodies about the positive patient, and our CDRRMO automatically conducts decontamination of the positive patient's household or house or home, including his office, and if he has a car or vehicle, then that is included in the decontamination. May I show you the 7 basic principles that we have formulated with regards to contact tracing. One is there should be a seamless collaboration between law enforcement and our health authorities. Why is that? Not during the first 3 weeks of contact tracing, this is solely being done by health authorities. And when we started to go over their results of their contact tracing activities, we finally realized that there were a lot of gaps and misses. And I just would like to inform you that our health authorities are doing a great job, that they don't have that investigative mindset. You should understand that contact tracing is similar to investigating a serial offense or a criminal offense. So it requires the involvement of an investigator, someone who has extensive experience in investigative skills. Like, for example, how can you determine if the person is lying? One thing about investigating a positive case is that most of the time, the positive patient will usually not mention that he came from a critical area, or probably he would like to avoid telling the truth, showing some signs of deception. And this is something that cannot be detected by our health authorities. In the same manner that our health authorities have those skills wherein they will be able to detect who are considered as high risk, moderate risk, or low risk. These things cannot be detected by our law enforcers. So it requires a joint effort. Kaya yung aming contact tracing team, it is usually composed of a doctor or law enforcer, or a nurse and a law enforcer. Extensive testing is critical to contact tracing. And this is something that I would like to share with you again. In terms of extensive testing, during the first month of our ECQ, should remember that we don't even have the adequate supply of PCR test kits. In fact, in Baguio City, which is considered as the testing center of the entire northern Luzon, we were only given 100 test kits for a population of 10.5 million. And that's the reason why we need to innovate. And one innovation that we did was to apply what we call the Huawei artificial intelligence CT scan analysis, wherein we were able to immediately detect a potential COVID-19 patient in a matter of 7 minutes. And at the same time, what we did was to acquire as many rapid test kits as possible. Why is that? Let me just show you how RDT enhances our contact tracing. RDT refers to rapid diagnostic test kit. Take the case of this positive patient wherein we have a set of first level and second level and third level contact. This is just a hypothetical case. Looking at the slide, you see 10 first level contacts, but that is not the case. Usually, ang first level contacts ranges from 50 to 150. In one particular case, we have 153 first level contacts. And can you just imagine how can a particular team with a very limited resources cover all these first contact level, and as you go lower, lalong dumarami pa yung mga contacts. So what we usually do is subject the first level contact to RDT. We're applying what we call a bullet cannonball concept. First, we use the bullets, which is low cost, to determine who are the potential high-risk patients. And with that, we'll be able to determine those who are considered as negative. We can immediately eliminate them and concentrate on those positive results, either IgM or IgG. And after that, we immediately launch the contact tracing, but please take note that these three first level contacts are subjected to PCR tests. So by process of elimination, with limited resources, we can focus our attention, we can focus our contact tracing operation. 3 is transparency and speed are indispensable. And I would like to emphasize that every second matters and not every day matters. And that's the reason why immediately when we have a positive patient, ako na mismo ang tumatawag doon sa kanya para to convince him to disclose his identity in public. And at the same time, speed is equally indispensable. Why? Kasi kailangan natin ma-determine kagad. Our average is that in a matter of 24 hours, in 24 hours, we'll be able to contact trace at least 70% to 80% of the first level contacts. That is our average accomplishment in the city of Baguio. But during the first, let us say first 1/3, 30% of our positive patients, we are hitting around 2 days, 3 days before we will able to contact or identify our first level contacts. This time, because our contact tracing team are a bit convenient or comfortable with what they're doing, they can basically identify 70 to 80% of the first level contact in just 24 hours. Let me now go to cognitive interviewing skills, and this is one of the special skills that are needed by our investigators and contact tracers. Cognitive interviewing skill is a usually do this actually conducted is a 14-day training given to special investigators. Not all investigators have this skill. And one thing about this is it helps an investigator with this particular skill will be able to help our positive patients recall incidents or happenings that transpired 3 weeks ago or 4 weeks ago. You should understand that a patient, once he finds out that he is positive for COVID-19, he experiences or she experiences general arousal syndrome. Ang ibig sabihin nito, he becomes, his anxiety level is just so high, he's agitated, he's irrational, and how can you just imagine interviewing someone who is basically experiencing general arousal syndrome? Very difficult. That would be very difficult. And that's the reason why our investigators are trained to calm them down. Pinapakalma, pinaparelax, so that we will be able to immediately get all the necessary essential information as fast as possible. With this cognitive interviewing skill, because this is something that was not learned by our health authorities, what we did was we conducted a one-day training to our nurses and doctors who were involved in contact tracing. But giving them a one-day training will not is not sufficient. It's not adequate to equip them with the investigative skill. That's the reason why we should partner them with our law enforcers. Next is the use of technology. And I will be explaining this later on. We're using analytical tools and a GIS platform. Third is successful city is highly dependent on the quality of information. I just would like to emphasize that yung contact tracing is not just simply linking one person to another person, one contact to another contact. You have to establish the substance. You have to establish the content. You have to establish the story behind each and every contact. And finally, there is no substitute to being proactive. And what do I mean by this? I just would like to alert those local government units who still have no COVID-19 cases to start establishing their contact tracing capability. This is the right time for them to establish it. Why? Why? Don't follow our example, our experience. During the time that we were establishing our contact tracing capability, we have about 9 or 10 cases, and most of our contact tracing teams were out in the field. It's so difficult to bring them in and train them. So I would like to caution our local government unit, start working on your contact tracing capability. Our contact tracing e-system has 3 components. One is the COVID data collection tool. Second is the GIS platform for geospatial analysis. And finally, our analytical tool, which we're using, and this is relative to link analysis. This is the user interface of our data collection tool. It has 7 main directories and more or less around 80 fields. 80 fields, and it's user-friendly. It's basically user-friendly. And this is the back end or the spreadsheet of all the information that's being collected. You see on the upper row, you can see all the 80 fields from the name of the patient to the GEO, to the including it's the symptoms, including the date of quarantine, where he is confined, including the GEO tagging, the grid coordinates, so that we can reflect this in the GIS platform. On the left column, you can see the history, the details, the specimen, and you can immediately click this link so that you'll be able to look at the analytical tool that we're using for the link analysis. Okay, this is a classic case of the specimen information, wherein most of the time we usually use RDT because of the lack of PCR test kits. And then once we identify someone to be positive with IgG or reactive IgM, then they're immediately subjected to PCR test. So this is basically the specimen information. I would like to show you another history of a very special patient who was confined in the hospital for 44 days. Can you just imagine, for 44 days? And he has all this history. Now going to our dashboard or scoreboard, this is an external dashboard, meaning that this can be verified by the public. And with that, it also includes a web GIS wherein the public can actually see the location of all the positive patients, including those suspected and possible or probable. So this is real time. This is real time, but the analysis is not as intense as as the GIS platform that we are using. Okay, this is now our COVID-19 GIS platform. And if you look at it, it's if you look at it, you might think that it's a bit complicated. It has different icons. Itong black and red, this is an icon showing a positive patient who died, and we only have one death, and unfortunately, the patient had tuberculosis as an underlying condition. Yung yellow naman, yan yung mga cases na suspected. Yung blue are probable cases. The red and the green, these are positive cases, but they were able to recover. So those are basically the icon. I would like to inform you that this GIS platform for COVID-19 is using the Crime Information Research and Analysis System of the Philippine National Police. And this is something that we developed when I was still the regional director of the Police Regional Cordillera. And when I joined National Headquarters as director of the IDM, we were able to have this implemented nationwide. So all police stations practically uses this system. Instead of using crimes as icons, ang dinidisplay po namin are COVID-19 cases. So this is readily available in the police station. So basically, the GIS platform captures and stores and manipulates data, and you can actually overlay, since it has several components and it has layers. You can actually overlay information over different types of maps. So you can actually visualize the extent of the potential infection in one particular locality or particular area. So let me just show you a brief video. Probably this will take about 30 minutes.
Papasok pala tayo.
Okay, you can actually zoom in and zoom out so that you can specifically determine the exact location of one positive patient. We usually use this system for geospatial analysis, especially when we want to determine what are the parameters in locking down a particular barangay or a particular or particular area in one barangay. So each icon, every time you select a particular icon, it displays its attributes, which includes the name of the patient, the age, the result of the test, the status of the patient while confined inside the hospital. So this is our COVID-19 GIS platform. Now let me show you our analytical tool for link analysis. Okay, our analytical tool, we're using a very special type of application. And unfortunately, right now I cannot give you the name of that application, but it is an application that we are using in the Philippine National Police. So in short, again, instead of using this to investigate crimes, we're using it to investigate COVID-19 patients. So this system is actually in the Philippine National Police. Unfortunately, I just would like to inform you that this technology, while it is true that they are in the Philippine National Police, many of our commanders forgot about it, unfortunately. In fact, this system, we were able to put it up through the help of the U.S. Embassy. We invested, when I was the head of the IDM and CIDG, we invested around 100 million. 100 million. Kaya lang nakalimutan nila hindi nila alam na yung system is actually in one of their departments, yung ITMS. So when I met with General Gamboa and members of the top hierarchy of the Philippine National Police, I mentioned to them that this system is actually in place and in one of their servers in their information technology department. So this, you can see, is a bit confusing. Initially, you will think that it's just so complicated. No, it's not. Once you are into it, you can see that it is just a simple program, but the analytics is so intense that you can actually determine the connections between positive cases. Let me just show you a quick video of this, just to give you just to orient you. Yung nasa taas po, yung parang ruler dyan, that is the timeline. Yung orange boxes, this is the date of onset of the infection, and the green one is the date of release from the hospital. And at the same time, you can see small dots. Later on, when we zoom in, you will see the actual information per particular icon. With all the data that we are processing, no human brain can actually process this. You know, especially when we are already managing big data. No human brain can process that. Only technology can process that. So this is now the short video. So as you can see, I'm sorry. Okay, this is one particular, this is a very, very classic case that we handled one street sweeper with 153 first level contacts. So you can actually generate the story behind each contact to understand better if the person or the contacts are high risk, low risk, and you can determine basically the story behind every infection. And you'll be surprised that when you are encoding all this data, some of your positive patients are actually linked to one particular establishment, or they're linked to to one particular positive or asymptomatic patient. As I've mentioned, it looks a bit complicated, but actually it is not, you know, once you are into it. Okay. So this is what our temporary operation center looks like. Itong center na to, we have already demolished it, and we're now building a 1.7 million. It will be inaugurated this coming Wednesday, that's tomorrow. And probably soon, I'll show you a real-time picture of our new operation COVID contact tracing operation center. That ends my presentation. Maraming salamat po sa inyo lahat.
Thank you so much, Mayor Benjie Magalong. I'm so impressed with your presentation. Let me call now Mayor Noel Rosal. Are you here, sir? Mayor Rosal?
It's here, ma'am.
Okay.
A minute.
Or do we proceed to our international panel?
We can proceed with our international panel, ma'am.
Okay. Let's have first Dr. Long Vu of Vietnam from the Ministry of Health, please. Dr. Longbu.
Yes,
Yeah. Good
I,
morning.
good morning.
Please, you can take the right for your presentation because of limited time. We will have Mayor Rosal when he is ready. So, Dr. Longbu, please, thank you.
Yeah, so I want to, what? I want to share with you my presentation. So in, I want to share my screen. Yeah. Can you see my screen, my presentation in?
We can see your screen.
Yeah, thank you.
Thank you.
Yeah. So my name Long from the Ministry of Health of Vietnam. Now I'm Vice Chief of Division of Communicable Disease, and so recently I'm also actively involved to the COVID-19 pandemic control in Vietnam. So I would like to share some of our achievement, experience, and lesson learned from Vietnam to all of you. Thank you very much again. So I will, as you know, that Vietnam have some characteristic similar to Philippines, with large population. We have around almost 100 million population, and but we have a long border with China. So from beginning, it's a very high risk for Vietnam to have imported cake from China. And as you know, may know that up to now we have 334 confirmed case. And in Vietnam, confirmed case means that anyone have a positive test with COVID-19 is a confirmed case. So Vietnam, we have 3 states of, up to now we have 3 states of COVID. The first state from 23rd January up to up to 6 March. So from that one, we have 19 reported cases. This one, almost of them are imported case from China. We have 16 case. So after 16 imported case, this one, we have around 3 weeks have no new case. But after that, we from 6 March to 15 April, we have a next second way that with many imported case and the community transmission in Vietnam with total 255 51 case. This one is in this time we apply most of the high technology in Vietnam to apply for the contact tracing and rapid containment. For the third step is we have called no local transmission. It's almost already 60 days from 16 April up to now. During this time, we have only 83 case. All 83 case here is the imported case from the international flight, or this means that we have applied from the other country to rescue Vietnam citizen stuck in the other country, or we also have experts want to go to Vietnam for the work. And as you may know that during this time we already have 210,000 Susutake have removed. So a lot of any close contact with the patient and have any kind of symptom like cough, fever, and sore throat, we consider it as a suspect case, and even anyone from the outside country come to Vietnam and have a symptom, we also consider as a suspect case. So a lot of tests have been done, and there are 550,000 people people under monitoring. And here monitoring in Vietnam, we have two kinds of monitoring. One is the centralized quarantine with 150,000, and second is for self quarantine. Self quarantine it means that self quarantine, they quarantine at home. They cannot go out at home, and total around 400,000. So totally 550,000 people under monitoring, and more than 360,000 tests conducted, and we have around less than 0.1% positive. So compared with the total test we have done, the number of cases is still very few. So based on our experience, we can see that we have something done well and not well. So for the first stage of outbreak, for contact tracing in Vietnam is not so good, but and it is a good experience for us to strengthen our contact tracing in the second stage. So in the first step, we didn't know well that who is come back from the China. You can see that in the first step, only in China have COVID, had COVID. So at the time we didn't have a well strategy to monitor the imported patient people from the pandemic, from epidemic area. So after that, we strengthened our criteria to monitor the imported people. First from China, and second we expand to Korea when we heard that they have an outbreak in Korea, and then we expand to the Europe and Asian, and then from 24th March we expand to quarantine all the people come back from the other country. And in the second way, second stage, we also have problem in the infection control in the hospital. So we also identify some cluster in healthcare facility. We have to close, we call close or lock down the one big hospital in Vietnam, and for 14 days. And we mobilize a lot of human resource and to control the cluster in the hospital. And because we may know that in hospital we also have a lot of patients. They go in and go out from the hospital. So all the patients, when they is the outpatient and have a history of going into this hospital, we also request all our local health authority to take back them and request for them register as the monitoring and do the testing. So for only one hospital, we already test for 50,000 tests for this hospital. And this is one of the very good example for us for the contact tracing. We apply the IT information technology, so everyone who has the mobile phone, we also request the telecommunication company to say back just anyone who already have more than 15 minutes stop over around the hospital to so we request all of them to have a declare the health and then do the testing. Something we have done well that we have a good commitment from the highest level, from the President, Prime Minister, and also we set up National Steering Committee and almost work 3 times per week. And we proactive and respond very early. As you know that when the China that informed the first case in 29 December last year, we already start have a meeting to how to respond with this information. And when the people still consider that we should wear mask or we should quarantine imported people or not, so Vietnam already applies this kind of prevention measure. So early response is a very key word and key measure for Vietnam to get this achievement. We also strong cooperation with WHO and USCC and other stakeholders. So you can see that the information in Vietnam is very transparent from beginning. Even recent time, many people still not believe well that the case in Vietnam, why it's so slow, so low. But the WHO and USCC in Vietnam, they work with us from beginning, and they still very believe about our number. And we also apply the all kind of treatment for the patient. So luckily,
Dr. Longbu,
yeah.
You just have 2 minutes. We're running on our time. Thank you.
So we what we also do some we enhance our surveillance to detect every possible case that we expand suspect case, aggressive contact tracing. We not only contact chase for the close contact, we also chase for the second or third tier of close contact. So including anyone who have no symptom. So it's a very good experience for us. And we quarantine all the people suspected and the imported people for 14 days. So this one, this presentation shows that some kind of activity and showing that engagement from variety of people from different sectors. So here I would like to have the last one. What's the challenge for us? And this is the most challenge for us is the imported case from the Vietnam citizen coming back from other country and foreigner also. We have a request for economic development with epidemic control. So this is very difficult, how we balance between the epidemic control and economic development. So the way forward for us is to prepare the long-term and certain transmission and keep enhancing surveillance, ring fencing of the virus, outbreak containment. We still apply outbreak containment up to now and protect healthcare staff And the most difficult and important thing for us right now is how to reopen the international flight and the tourism. So yes, we open time for the question from over you. Thank you very much.
Thank you very much, Dr. Longvu. May we have Mayor Rosal? Are you here? If not, we will proceed to Dr. Ed Araral.
I think Mayor is here. Si Mayor, Jeb.
Mayor Rosal, are you here? Are you with us? Dr. Araral, are you? I can see your name there, so probably we can have Dr. Araral to make his presentation.
Yeah.
And please, the staff of Mayor Rosal, please give us a heads up if he is ready. Because after Dr. Araral, I will call Dr. Lozare if Mayor Rosal needs more time.
Yeah.
Thank you. Please, Dr. Araral.
Yeah. Thank you, Malu. Thank you for the invitation. Diana, could you flash my slides, please?
Thank you, Mayor. The agenda. Hello. Good morning, Gerard po. Hello.
Mayor Rosal, hello. Kayo po ang isusunod after Dr. Araral. Mayor, is that okay? Can you give me a thumbs up? Thank you, Mayor Rosal. Dr. Araral, please.
Yeah, thank you, Malu. I'll make my presentation very quick in the interest of time. I will just focus on the use of digital technologies with examples in Singapore. Next slide, please. So I'll talk about the Singapore situation, the use of technology, the issues that we face, and then I'll conclude from that. Next slide. So currently we have about 40,000 cases in Singapore. That may seem to be alarming, but about 95% or 98% of that happened in the dormitories of foreign workers, which are very, very much congested. But in the general population, it's very low and stable with very low death rates, such that this week, almost all of the restrictions in the circuit breaker will be lifted up. So we're almost close to 90% opening up of the economy again this week. Next slide. So let me talk about the contact tracing practices in Singapore. It's largely coordinated by the Ministry of Health, but with the participation of the police, security agencies, civil servants, and its whole of government approach. The target is to complete all contact tracing up to the third degree of contact within 3 days, because this is the most effective period of time. Beyond that, the contact tracing would become useless if the contacts are not traced immediately. The contact tracing effort is mainly driven by human effort, and technology is just used as a complement. Next slide. We started with a contact tracing app called Trace Together. It's Android and iOS based, uses 4G. But the problem is that only less than 35% of the 5.6 million population of Singapore subscribe to this app. It's well below the target of 70% of the population. So it's not working. And we were faced with battery issues, only works for 4G, so elderly people don't have the 4G capabilities. People who are using analog phones cannot use this. So we shifted to another technology. Next slide, please. So today, this month, the government will roll out a new innovation scheme. We will be using a Bluetooth. We'll be using basically a token-based approach to digital contact tracing. It's a small device. It uses Bluetooth. There's no need for internet. There's no GPS tagging or geolocation. It's not as sophisticated as the one presented by Mayor Magalong. There are concerns about privacy. It doesn't require internet. Data is only stored at that token, and it's immediately deleted, automatically deleted after 25 days. And only authorized staff of the Ministry of Health would have access to this data. This is to assure the population that there are no privacy concerns, that the government will not store your data. It roughly costs about 700 pesos. It's locally produced. So this is another option for the Philippines if the government might want to try this, especially for people who do not have access to smartphone or internet, and those who are concerned with privacy. Next slide. Okay, so I think I understand in the case of the Philippines, they use this app called Stay Safe. But because it's a large country, it's an archipelago, it's difficult to do contact tracing, and it requires 4G. And a lot of people, Filipino people, still don't have that 4G capabilities. Quite a number of suggestions have been floated around. The suggestion by former DICT USEC Eliseo is to use an integrated platform, use a data warehouse that can be compatible using 2G and use of tokens. So I'll leave it at that. I think that's all I can say. We're now using this token approach that solves the problem of privacy and solves the problem of cost, and is also equitable and can be used for cities and areas where there is no internet. That's all, Malu. Thank you.
Thank you so much, Ed. May we call Mayor Rosal, please? Mayor. Oo nga, in the light of, I think Mayor Rosal is still performing his function. Mayor, okay ka na?
Hello.
Hello, Mayor Noel.
Yeah, good morning, everyone.
Okay, please do your presentation. Thank you.
Thank you. Good morning, everyone, my fellow mayors, especially our visitors and joining us also from Singapore, Vietnam, to everyone, and USAID. It's been an honor for me to be a part of this meeting. Mayor Magalong and the other mayor, I was not able to listen to his presentation. So Legazpi City, as you all know, is the center of, together with Naga City, is the center of Bicol region. And considering that most of the cases, because of being as the central area in Bicol, so most of the cases was really in the city and the province of Albay. So the very best thing that we have really to do, and I would like to share everyone in these very hard times, and as you all know, we don't have as much as the facilities if you compare with first-class country like Singapore or even US. So the very best thing that we have initiated is to strengthen our contact tracing, which was the key for the city of Legazpi. We have a total of 29 cases only, actually, compared to major cities. But this 29, if you will relate it to the population of Legazpi, is already quite huge. Because we have only about a population of about 200,000. Now, we always maintain the shared responsibility. If you will see the contact tracing process at the local level, it should be an effort between the national, the local, especially the barangay, as our first line of defense, and of course, the task force. If you will see in the diagram, upon identity of the contacts, we have to assess the following. Presence of sign of symptom, very important. Yung may mga exposures. Identify if contact is a health worker. Okay? Then next now, we have now the start of the contact tracing by the PNP with the local health authorities. That's meaning that is the rural health unit and the barangay level. So the list of close contacts, locate them further, identify, and profile other close contacts and classify as follows. So number one, there are 3 types, only home-based monitoring and for daily monitoring. Number 2, there's also home-based quarantine plus COVID-19 testing and health facility isolation plus COVID-19 testing. Now, if you will now see the entire process, in the entire Bicol region, which is about 6 million population, it was really Legazpi who has initiated the mass testing, the mini mass testing, which for me, very important. The testing process should be the key. Because if mass testing is absent, it will be very hard for those identified under the contact tracing. So with this, at least Legazpi purchased 2 PCR machines, which was the key to at least test at least 600 tests per day. Okay, so that is. So let's go now to the case investigation process. So assuming there's a confirmed case, number 1, we have to profile the case, assess the presence of sign of symptoms, identify and list close contact and contact information. Then submit to the contact tracing and monitoring team compiled profile and close contact line list. And this is the very initial phase, which is very, very critical if we want to really zero in on those exposed and possible, we call it suspect or probable cases. So if yes, the very first thing to do is to list of cases at home requiring facility isolation, refer to appropriate isolation health facility after clinical assessment, and number 3, commence contact tracing by designated team. Okay, if no, we have to commence contact tracing by designated team. Now, all in all, this has been the success of Legazpi. Out of the 29 cases, would you believe the 28 already recovered? 20 and one death, which although was a victim of COVID, but according to our hospital, it was because of his stress. At the very early part of the COVID in his body, he succumbed to cardiac arrest. So before I close, number 1, the very thing that really made Legazpi very successful is because of the very organized task force composed of various local governments, unit in the lowest level, government agencies, which almost every day meet to assess the daily situation, especially during the very, very early part of the lockdown in Albay. So that sum up now why Legazpi, even though was the center in the entire Bicol, was one of the very first city who was downgraded to modified general community quarantine. And up to now, we are still maintaining our isolation area, which is one of the first in the country. And the only right now functioning, maybe on the truest sense of isolating the LSI and the ROF, which is the definition is the locally stranded individual, those who are in Manila right now, coming home. So we have to really save them. So it's just a matter of putting up the process. The ROF is the returning overseas Filipino workers, which with the help also of the national government, we are processing them, and they have also to join the process for everyone. A 14-day quarantine, a swab test, and of course, the clearance from our rural health unit. So that sum up it all. Why up to now, the business now in Legazpi is almost 80% already open, but with the control in the restaurant of a 50% occupancy. But many really were amazed that even though we're the center, but we have recovered fully because of the contact tracing, the mass testing, and of course, the isolation facilities. Again, thank you very much.
Thank you so much, Mayor Rosal. May we have now Dr. Lozare?
Thank you so much.
Thank you, sir.
I'm very happy to join you and inviting me. I have to say that all the presentations are extremely impressive. And your presentation, Baguio, to me, could be an international model, certainly, in Zamboanga and Vietnam. And all of the presentations were just excellent. I'm afraid, though, that I have not been in the Philippines for the last couple of years. Although I read 4 Philippine newspapers every day, every single day, I wouldn't consider myself well informed about what's happening. And I may be coming from a very broad strategic perspective where I would say, this is what I would like to see in the Philippines 10, 15, 20 years from now. And I would like to start by showing you the slide about PTSD. Everyone knows what post-traumatic stress disorder is. And everyone knows that a pandemic like what we have now, earthquakes or... wait, I don't think you can see my slide. Are you able to see my slide? No.
Sir, unfortunately, it's not yet up.
Okay, let me try. There you go. Can you see my slides now?
Yes, sir. Just click because I can see everything. There
Okay.
you go. Thank you.
How about the others? Can they see everything now?
Yes.
Okay, good. Well, I was talking about PTSD, disorder. Everyone knows that the pandemic, earthquake, 90% of injuries are mental health issues. And when you have lost your parents, your children, your house, that poses a very serious mental health issue, and many of our health workers may not be trained to detect that. One thing going for the Philippines is very robust, and that is the ability to resist stressors, because we have typhoons every year. We have all kinds of disasters. The Philippines may also score high in resiliency, and that is the ability to spring back to an original state after being exposed to stressors. Leyte, Samar have recovered. Maybe we have a little bit of a problem in Marawi in terms of resiliency, but I think we've made a lot of progress in this regard. Where I think we may be short of is a new concept that I've been working on. Oops. which I call post-traumatic event growth or anti-fragility, the ability to grow after being exposed to stressors. In short, I'm thinking about 10, 15, 20 years from now. Definitely, we're learning a lot of lessons in this pandemic. But are we going to remember them? Are we going to apply these lessons? Or could another pandemic come and we'll still be back to the same old lessons? And unfortunately, we've seen this happen many times. There were no lessons learned. Now, that to me is a serious problem. So I would approach this issue, and I don't think I know about the specifics of contact tracing. I've invited two of my colleagues in the Philippines who are, I think, present here, who are working on contact tracing. Maybe can they help me out in the detail. But let me start with the question. I am a CNN reporter, and you are a minister or secretary of agriculture. And I ask you, who produces food in the Philippines? The Department of Agriculture or the farmers? Your answer would be the farmers. So what does the Department of Agriculture do? You provide assistance to farmers. You provide them with fertilizer, with help, technical assistance, information. You build roads and bridges, help to the market. Now, imagine you are the Secretary of Health in the Philippines, and I am a CNN reporter, and I ask you, Madam Minister or Mr. Minister, who produces health in the Philippines? Doctors, nurses, midwives, community worker. And if you say the Department of Health, we may have some problem with that. I think just like the example I gave, families, individuals, and communities are the primary producers of health. And I'm a little disappointed that many of our interventions on COVID, there's too much emphasis on what the government's doing, but very little on what families, mothers and fathers and communities are doing. I'm a little disappointed that the quarantine issue has become a law enforcement issue, not a public health issue, which should not be the case. I read about this mother who died trying to walk from Manila to Camarines Sur. I read about the kind of permits that we need. I read about policemen, law enforcers who violate the quarantine rules themselves, or some of our congressional leaders who do that. But what is the implication if we recognize that families, individuals, communities are the prime producers of health? They should be the center of action in our response to COVID. How feasible is it for a health worker to be present when someone gets infected with COVID-19 or with TB or with HIV and say, no, 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 don't do that. You'll get COVID-19 or you get TB, you get. And certainly it's very difficult to imagine that a health worker would be present. So what is missing perhaps is an emphasis on health literacy. That our parents, our mothers, our fathers know and understand the dangers, the risks of COVID infection. Which category of health providers the biggest number worldwide? Doctors, nurses, midwives? Our answer, mothers. Mothers are a #1 health provider. When someone gets sick in the family, who makes the diagnosis? Who makes the treatment? Who takes care of that sick member? And it's the mothers. And I think we need to invest in improving health literacy of our people so that our families and household become the spearhead in any health effort. Not the Department of Health, not the doctors and nurses, but our health educators. When you look at the numbers of personnel per 1,000 births, okay, number of providers, household, 4,000, government 4. Why 4,000 in the household? You have the mother, 1,000, you have the father, 1,000, you have the auntie, and you have the grandmother. Per capita expenditure, households spend more. I'm on duty 24/7, government 40. Commitment, higher in household, but they are low in skills. So I think this is where we may be short. I like the whole of society approach in Vietnam, but then I think we need to emphasize that any effort to fight future pandemics should be centered in educating our households and communities. So where are we now? My slides are not moving. I hope I can make it move. Okay, when you look at the burden of disease attributable to 10 selected risk factors, according to the underweight, malnutrition, household, unsafe sex, household, unsafe water, sanitation, household, indoor smoke, zinc deficiency, iron deficiency, vitamin A, blood pressure, tobacco use, cholesterol, all of them happen at the household level. And building more clinics and hiring more personnel may not help us. Now, toward the end, I'd like to share with you one of our insights on leadership. When we studied, I teach transformative leadership in developing countries. We think of the leader as the one being on top. But when we studied the literature, we were surprised that people recognize that there are leaders at all levels. It's not just at the top. There's leader at the provincial level, the city level, the barangay level, the community level. And in every organization, that is the situation. But the most interesting thing that we discovered in the military, where they value leadership so highly, in the military, they say the most important leaders are the ones below. And they say armies are run by sergeants. You know, sergeants, they are non-commissioned officers. Not lieutenants, not captains, not majors, not colonels, not generals. The best armies are run by sergeants and navies by chiefs. And the army with the best sergeant is the stronger army. Now, let me close by saying, to me, the only duty of parents is to teach their children how to swim. I don't mean that literally. What I'm saying, as parents, we should know that we can never be present 24/7 in our children's lives. And the government cannot be present 24/7 in people's lives. And to me, the main task of government is to communicate, to invest in communication, and make sure that people will look at quarantine not as a law enforcement issue, but as a public health problem. If you're not convinced, I'll show you some data we have from South Africa. We're working on HIV. And we had a $1 million television program, and we got a 4% impact. And the donor asked us, only 4%? Wow, you spent $1 million. But then we said, yes, that 4% translates to 668,91 people who would have been positive without prevention behavior. You multiply that with $400 annual cost of ARB, not including transport and pain and loss of production, you are talking about 5.3 billion in 20 years. So when we think how much we have invested in COVID-19, I think we forgot that families, mothers, fathers, households are the most critical element in the production of health. Marami pong salamat.
Thank you so much, Dr. Lozare. That was a very inspiring presentation, and it contextualized the whole effort on contact tracing. At this point, it will be open forum. So for those who are attending, you can write your questions using the chat button. To start off, let me shoot the first question to the three mayors. Are you still here? Mayor Beng, Mayor Benjie, and Mayor Noel. I just want to understand your thinking process. How would you characterize the first three steps you took when you heard about COVID-19? The mayors?
First, once again, thank you very much to USAID. And you are also the inspiration to me, Malu, politically. First of all, like what Dr. Benjamin Lozare said, I am a family counselor, and the priority and the first line of defense should always be the family. The doctors are saying we are not the frontliners, we should be in the last line of defense. So in strengthening the family, we must give families the social responsibility to be protecting their loved ones. So the first line of defense should always be the family together with the barangays. And the first thing that I did as mayor, as always, is to organize. What we have in the city of Zamboanga, we see Muslim professionals, Christian lumads coming together, and local communities telling ourselves that we must do something because we are unsure of this enemy, unlike the siege. And we have to work very hard against the pandemic because we can never go back to normal.
Thank you, Mayor Beng. Mayor Noel? Mayor Rosal? Oh, okay. Mayor Magalong? Sir?
Hello. Yeah. Yeah, this mayor.
Mayor Rosal.
Yeah,
yung tanong ko is, how would you characterize your first three steps? The first three steps you took when you heard or read of COVID-19. As a leader, paano ho nyo yung nagawa?
Yes, number one, lahat tayo, we are all here first timer. And yan ang pinakapara. And siyempre, the very first case for Legazpi is really something that it's really unforgettable because of the thinking that it might be a start of a chaos. That's why you have really to be very firm in your command on the task force. The very first thing that we did is to identify what barangay and immediately issued an order of a lockdown on the two adjacent barangay. And with the lockdown, we were able to control the movement of the people. And that really made the difference. And put our enforcement agencies as in charge of the two barangay. And of course, after that, we have to now see the plight of the people in the barangay, how to feed them, how to deliver the food. So after the lockdown, we have to immediately start now the tracing, using now an interview on the positive case himself. Then while the tracing, the contact tracing is ongoing, we have to plan now what to do with the constituents, especially their daily lives. So we have now to mobilize our task force to form now a team for every aspect of the lockdown, meaning how to deliver the food. Number two, the needs, the basic needs like medicine, and of course, to be able to control the movement, and of course, the damage psychologically to the entire city. So with that, we were able to really control the situation and appease the minds of the people that we are on top of the situation. So would you believe, with that first positive, we were able to identify only one positive, which was the member of the family. The rest contact, because of our testing machine that we were able to put up, and the very first local government in Bicol to put up the isolation, which I can really honestly say and proud of to share this with all the mayors in the entire country, that the isolation is very critical to save the family. Because if you are a suspect or a probable person, you have now to be isolated. And that was the key for Legazpi. That's why we were able to control. So the rest is history. As I've said, despite being the epicenter, Legazpi now has almost 0 case of COVID-19.
Thank you, Mayor Rosal. Mayor Magalong? Sir.
Hi, Malu.
Sir, ang
Hi,
tanong
Malu.
ko,
Yes.
what were the first 3 steps you took when you heard or read about COVID-19 as a leader?
Come again, Malu? Yes.
As a leader, what were the first 3 steps that you took when you read or heard of COVID-19?
Okay. First thing is you have to organize. And then you have to plan. But you know, this is something different. This is a situation during normal times you usually plan, then execute. This is the time where you have to simultaneously plan and execute. Even in our doctrines, we've never seen anything like COVID-19. So while planning, we were executing. We were had to put up systems in contact tracing, systems in delivering relief, systems in logistics, systems in our procurement. Third is communication. Importante rin that you have to communicate what you're doing to the public. You have to communicate to your people. You have to communicate with your department. And finally, leadership. I think that's the most critical part. Leadership at all levels. This is not the time for you to be surrounded by mediocre. This is the time to be surrounded by leaders. So you have to develop leaders at all levels.
Thank you so much, Mayor Benjie.
To make a comment, if I may.
Yes, sir. Dr. Lozare, please.
Yeah, because there were 2 comments by the speaker about the importance of planning and that we need to show that we are in control. I just want to share a concept, they call it scenario planning. And the basis of scenario planning is no one can predict the future. No one can. But scenario planning starts with imagining what could happen and then coming up with appropriate plans for each scenario. So scenario A, you have plan A, scenario B, plan B, scenario C, you have plan C. When I was in the Philippines, I was head of the Philippine Information Agency. Son Aquino was the president, and there was a series of coups. And I remember one morning, 7 o'clock, the presidential spokesperson announced on TV that there's a coup. And he said, the cabinet is meeting. And I called him right away, why did you say that? I said, you just announced that we're not prepared. What you should have said, there is a coup, plan B, plan C, plan A is being implemented and the cabinet is monitoring. So our standard of what planning is should go to the next step. No one can predict the future. But we know typhoons will come. We know earthquakes will come. We know that pandemics will come. And therefore, we know what happened now. And that's why I was stressing that post-traumatic event growth is key. That is strategic. All the lessons learned that we are learning now should be codified and should form the basis of scenario planning. Sorry for talking too much. Yeah.
Thank you, sir. Dr. Araral, there was mention of scenario planning, and I know Singapore is very much into that. Can you kindly contribute your recommendation for our local leaders on this? Dr. Araral, are you still there?
Yeah, I'm here. So, sorry, Malu. If you don't mind repeating the question.
There was Dr. Lozare mentioned scenario planning, and then to go into that. So immediately I thought of Singapore, since that is part of the DNA of the governance framework of Singapore. Probably you can share some ideas for our local leaders in terms of scenario planning or horizon planning to such extent.
Yeah, that's right. Scenario, because Singapore is so small, so vulnerable, whatever countries do affect Singapore. So it's in Singapore's DNA to really plan and plan at a very long time and do a lot of scenario planning, 20-year, 30-year, 100-year scenario planning. And most importantly, to respond to those different scenarios. So this COVID-19 is not a new thing for Singapore because we experienced SARS in 2003. So the systems, the capabilities, all those things that Mayor Ben Magalong mentioned has already been in place in Singapore since 2003. The same people who did SARS contact tracing and all that are still the same people who managed the COVID-19. So Singapore was very much well prepared to handle the situation when it came. We use a few tools in scenario planning. There's a software called Risk Assessment and Horizon Scanning. It's a machine learning tool. There's a scenario planning unit at the Prime Minister's office. It's a permanent unit. We have units that look at 100-year scenarios like climate change, and those scenarios are translated into actual plans with specific budgets, and so on. So I'll just stop that there.
Thank you, Ed. To our friend from Vietnam, Dr. Long Vu, are you still there? Sir, I have a question. Vietnam is one of the models being recognized in terms of battling COVID-19. To what extent is centralized planning impacted on the way you were able to mitigate and stop the pandemic?
Yes, so the key word for our planning is early quarantine and early response. So up to now, we apply the quarantine for all the people coming from outside Vietnam for 14 days and do testing. We have experienced that we apply test for all quarantine people for 2 times. One time that when they arrive in the quarantine area, and the second time is before they release for the quarantine. So we still identify some case that 1 or 2 days before they can release the quarantine. So it means that for the 13 or 14 days in quarantine area. So this is very important that we can prevent the disease imported from the outside Vietnam. Inside Vietnam, during the community transmission, we also apply the rapid containment. So we say for different title as close contact with the patient and the one who have a close contact with the contact to patient and the family, and we also quarantine for one small area around the patient household. So it means there's a different round, different fence of the quarantine. So it also identifies some day and to confirm that when we cannot identify the new case, it means that that area have free of virus, SARS-CoV virus. So we can make sure that our in Vietnam, inside the Vietnam right now is quite safe for people, but we still have a risk from the imported case from outside. And we discussing about how to reopen the international flight, but the decision is not yet. But the principle is very carefully. We have to consider very carefully. Should be we still need the quarantine for 14 people for the all day for all people coming from outside or not, or we can select some country that really safe, that they have more than 30 days free of COVID or not. So this still have many discussing, and we can share with you soon whenever we have decision for this. But I want to say that to reopen the country for development of the economy is very difficult and very need a lot of consideration and carefully. Thank you very much.
Thank you very much. Let me now go to the questions posted from Vincent Paul Elago. And I will just read this verbatim. To the mayors, as chairman of the committees on tourism and games and amusement, many affected establishments like resorts, restaurants, cockpits, internet shops, among others, have been coming to me asking for legislative facilitation to persuade the city government to allow their reopening. My question is, when do you think this kind of establishments should reopen? To our mayors? Mayor Climaco?
That's what's very important is to follow the national guidelines subject to the general community quarantine.
Hello?
How about, would there be a different, Mayor Rosal, yun daw mga cockpits?
Yeah, actually, good morning again. Actually, the IATF National identified into 4 categories. The industries, like restaurants, like factories. Then, you know, we have to do, I agree with them, Madam. And I know Mayor Climaco will also, and Mayor Magalong, that we have to do it slowly but surely. We cannot open it 100% on the first note. I think we have to do it slowly but surely. So we have categorized the 4 industries. Say 50%, like restaurants. Before it's only take out. Now under MGCQ, we can now have the dine-in, but at least 50%. Now, regarding that, you have lined up the many like computer, especially the cockpit. Cockpit right now is a form of gambling. It is not a sport. I agree with Secretary Anyo that really it takes one positive to generate thousands of positive cases. That's why in the Philippines, not as other countries, this is one of the most sought after gambling area, the cockpit or the cockfighting. That's why we have really to inform and we have really to live by it first, that we cannot tolerate first the opening of cockpit. That's why as a mayor, and Legazpi is also one of those center of cockpits. We have about 4 cockpits in Legazpi. I know that they also understood that we cannot really include first the cockpit. Even gambling right now in Legazpi, the bingo is still yet closed yet. No? So I think we have really to do it on a phase-based system, so that we can analyze first the weaknesses of every sector of our society. Thank you very much.
Thank you, Mayor Rosal. Are there other questions? Questions you would want to ask our mayors or our foreign guests? By the way, Professor Ben Lozare already left because it is already midnight in the US. So we're going across time zones. Any other questions? Okay, let me shoot another question to the 3 mayors. Mayor Climaco and Mayor Rosal, you are on your 3rd term. What one message, one key learning from COVID-19 would you advise an incoming leader in your locality? And to Mayor Magalong, this is your 1st term. Immediately, malaki ka agad ang naging problema na hinarap nyo. Si Mayor Beng Climaco is nagkaroon ng siege, ang daming nangyari in her 3 terms. Ganon din si Mayor Rosal being from Legazpi. Siguro what will you, the 2 outgoing mayors, because of the term limit, what would a single takeaway in terms of leadership and governance would you advise a young leader? And to Mayor Magalong, as a 1st termer, what is the key takeaway of your 1st term?
What is very important for me is data, and be able to, I always believe that we signed up for the job and God gives people the grace to do your work and finish your work by organizing.
Thank you, Ma'am. Mayor Rosal.
Right now, when it comes to disaster risk reduction management, it has been the key. We have been a consistent Gawad Kalasag awardee, a Hall of Famer, because of the notion in Legazpi that there are 2 important things that we have considered that also we can also relate to COVID or any pandemic that may happen in the future. No? Number 1, the system should be in place. Very, very important. When you say in place, the organization, the processes, and of course the resources, and of course the role of each members, be it in the local government or the national government. Hindi ko na pahabain, meaning the system should be in place in any given scenario or situation. And that is the key to the success of Legazpi, that despite being the epicenter, we did not panic because of the system was there. And number 2, that I can really relate to my successor is the success of any organization is the maturity of the people. Because I do believe, although the system is there, but if the people are not ready, it will really be chaos. So one thing that really triggered that the success of Legazpi is the maturity of the people. They believe in the system and they are part of the system. Because in Legazpi, it is a cascading system from the national, from the local, down to the barangay, down to the family, and the role of the father, including the children. Meaning, we define the role of each member of the locality. And that is why Legazpi is always considered as one of the top practicing in disaster management. Thank you very much.
you, sir. Mayor Magalong.
Hi, Malu. Yes. Probably one of the key takeaways is that leadership is key to crisis management. And it's not the right time to become popular. In crisis management, you have to come up with a lot of unpopular decisions, but it's simply the right thing to do. So, again, I would like to emphasize that crisis management is leadership driven.
Thank you so much. Are there other questions? We've reached the point in our learning session where I think we will have to conclude this event. Let me wrap up things. This is a learning session. This is the first. There'll be 3 others. We had contact tracing as the main topic for today. And we've learned so much from our 3 mayors, as well as our 3 international guests. Let me sum it up. The role of actionable information is data-driven. Leaders cannot act if the data is wrong and the analysis is wrong. Acting, not waiting, I guess, is one of the key takeaways among leaders. The leaders, the mayors do not know the enemy, but they had to act. Why? Because there is fear, there is anger among constituents, not knowing what are we up against. And the leadership provided hope to their constituents. Mayor Climaco talked about trust, which is the currency in dealing with the pandemic. Mayor Magalong spoke about seamless collaboration of public order and health. He also talked about training is a good investment in dealing with the problem. Our Vietnam friend talked about timely and transparent communications to get everything out and that everyone is informed. Mayor Dr. Araral spoke about the need to adjust technology to the audience. He mentioned about, you know, some of the people do not have 4G connectivity. Internet is a problem. So you need to adjust, and you need, in order to be effective, technology it shouldn't be the driving. It should be the bridging factor towards contact tracing. Mayor Rosal talked about shared responsibility and the importance of the barangays, the community. He also spoke about the ROF and the LSI and the need to plan for them. Malaking bagay ho yun kasi yung OFW, yan po ang isa sa mga dalawang drivers ng ating ekonomiya. Interestingly, Professor Lozare had a very good repositioning of how do we look at COVID-19. And he spoke of post-traumatic syndrome, which is related to mental health. He also posted a question about the little emphasis on family and community, and that the pandemic is a public health and not a public order issue. Again, another very interesting mention made by Professor Lozare was on the need for health literacy and getting the mothers really to be involved in the process. So on behalf of USAID, SURGE, PUBLiCUS Asia, and APCA, we would like to thank everyone who joined us today. The next learning session would be on June 18. So maraming pong salamat, and thank you very much for your time that you spent with us, the 3 mayors and our foreign guests. Maraming pong salamat.